most people want to stay with what's familiar. It's uncomfortable for us to make those types of changes. And it feels risky when you hear self-funding, because I think a wall goes up like, oh, we don't want to go bankrupt with our insurance. And I don't want you to either.
Hello. Welcome everyone for another episode of the Healthy Savings Podcast. I'm your host. I'm Sasha Kurbov with Milu. Today we have an awesome guest and an awesome episode, Lindsay Clarke Youngwerth, who's the founder of Keenly. Lindsay, thanks for hopping on board and doing the show.
Thank you for having me on, Sasha. I'm so excited to have this conversation.
Amazing. So we always start off just with a little bit of background. I'd love to hear who you are, how you got here, where you're calling from, what your business is like, what your family's like, all that good stuff.
Okay, in 10 minutes or less.
any amount of time.
How I got started, I'm originally from Boise, Idaho. I still reside in Boise, Idaho, and I love helping my community here. I got started in the business because I met somebody on an airplane who said, and at the time I was waiting tables, and I was also getting a divorce. So I knew I was this point in my life at 28 years old, I felt like I needed a big career, and I had never finished college. I didn't really know what I needed to do. And so anyway, by chance, met a guy on an airplane who said, hey, do you see something more for yourself than waiting tables? And do you think you could make, what do you see? Or you think you could make more money? I think he said something like that. And because he said something like, what if I told you could make $60K a year selling insurance? And I thought, I'm here for it. Next thing I knew, I took this test, their magic test, and decided I was going to sell life insurance. I had no idea how they recruited life insurance agents. I didn't know that was like a churn, deal where they get a bunch of pieces of spaghetti and throw them on the wall just to see what's going to stick. I had a lot of people who said I wouldn't make it. So I was like, I'll prove you wrong. And I hustled in life insurance for a good solid 2 years before I did employee benefits, and mostly because I would prospect to businesses. I'd walk into businesses all the time to do life insurance. And I figured, well, I should do the health insurance too. And then I learned how I could get paid with health insurance. And that just was more consistent for being a single mom. And made this segue into health insurance, and fast forward to almost 20 years later. And the industry has changed remarkably. I would say even 6 years ago, I was really kind of not having fun, just kind of going through the motions. Like, this is what we do. Here's how the price is. This is da-da-da. And then about 2020, I started to make this change in my perspective of how I could help employers. But I had to change the way I built my business. So I really needed to create this new foundation of who I prospect, what types of clients I take on, because I had a whole book of individual and family clients. And while they're fabulous and I love helping everybody in my community, I'm not able to make any change for those people in that market. And they do need help and they are valuable, but I had to figure out a new way to make healthcare more and more affordable for people, more accessible, more meaningful. 2020, I started to engage with Q4 Intelligence and doing a lot of their coaching, and it really brought a mirror up to some of my practices, and some habits were harder to change than others, but continue to move forward. And what I found there was a huge community of agents and people, or not agents, consultants, that are open to helping each other and filled with good ideas and enthusiasm about the business and how we're going to change things. And it really created this wonderful sense of belonging and purpose that just has helped me turn my ship essentially into this more like unbundled practice, transparency. It was something I really wanted to do in 2020 when a friend of mine who had built a bunch of direct contracts, Doug Hetherington in Boise, had said, hey, Lindsay, come and sell this with me. And I was not in a position to even start. with self-funding at the time. But now, this is the main thing I talk about. This is what most of the people that I speak to want to talk to me about.
What led to that change? Like, what did you see? What did you hear? What did you learn? Because it's not a small change, right? You go from selling a vanilla product that's there at prices that keep going up to like, okay, we're gonna build this ship, like, you know.
Yeah, I don't know if I can really pinpoint one thing. I will say that at the time I was working with a business philosopher and doing a business professionals course with the Boise network. And part of that learning practice was always anticipating new things in the marketplace and understanding what's available to help your customers avoid threats, right? You and me, we are helping people survive, adapt, and live a good life. And what was that going to mean, or what does that look like? And in anticipation of what is the marketplace going to bring to your customers that maybe you're not going to bring. And those are your own personal threats in business that you have to consistently learn about and try to move through, right? Because the marketplace is closer than it's ever been. It's literally less than 2 feet away from your face at all times. It's walking around in people's pockets. How am I going to have a voice? And that was one of the things. And that really started to trigger my curiosity, like an awareness. I mean, before that, I was always interested in how we could make change and make healthcare more affordable. But, I was kind of bought into, I was trained by people in the insurance companies. That's who taught me everything. So I was really bought into and believed everything that they said to me. And I always thought it would come from the federal government, and the insurance companies would make all of the changes and I would be the champion. And then I think about 2020, and with the help of the Boise network, was like, oh no, wait, I have to do it. And there's lots of people doing it. And I'd, heard about Health Rosetta, and I'd looked at that, and, it was kind of overwhelming. But I guess 2020 was this time where everybody was learning languages and making bread. And I decided, like, let's move this business up another level. So I don't speak Spanish.
I love it.
Really?
I didn't learn how to make bread. It's funny. I was just with a really close friend who, over COVID, quit his job and some other life stuff, but he quit his job as like a software developer, like big tech companies, baked a bunch of bread, got really into wine, and now he moved to France and became a winemaker, and like a really good one, but like COVID led to a lot of changes. Some good, some not so good.
Yeah, I had read articles at the time, like, oh, well, there's this big, huge disruption happening in our lives right now. That's quarantine and uncertainty, that it made other small changes seem possible, like totally acceptable. I'm going to change careers.
Totally.
Yeah.
What's Boise like in terms of healthcare? Like, what are the health systems? Do people have a lot of options? Is it all changing because the city's growing? What's the local market like?
That's a really great question. It's not really innovative right now. I would say there's just a couple, literally less than 5 consultants in the Valley that are consistently bringing alternatives to the market. So a lot of people really bought into the old way of doing businesses, mostly because they are not aware of what else is available. There are 2 health systems that are primary. They are both not-for-profit. One is St. Luke's Health System. They are the largest private employer in the state of Idaho. The largest private employer in my state, and located in the really just, I would say, nobody's going to know this, but the Treasure Valley, which is the Boise and surrounding area, covers, about a little under 1 million people. And then the Twin Falls, Sun Valley area, which is about 2 hours east of Boise and more central, but that's it. but they have the largest footprint. They're kind of the elephant in the room. And then there's St. Alphonsus, which is owned by Trinity, which is a smaller hospital system. And then, of course, outside of Boise, there's other hospital systems. But in Boise, we really just have two.
Got it. And then what are the employers like? Like, does it run the gamut? Is it a lot of smaller employers who haven't thought about self-funding? Mm-hmm. Like, what's the landscape?
It's everything. We got, it's interesting. I was thinking about this morning, that there's a little bit of a changing of the guard. So a lot of people, it's very independent. Idaho is so independent. We do things our way or it's the highway kind of deal. Everybody has their own interpretation of what that means, and it's very accepted. And I mean that in the most positive way. But so you have a lot of independent business owners. Owning your own business is kind of a thing. That's what people do.
That's awesome. So I love that.
It's a lot of private industry, a lot of ideas, a lot of like, I'm going to go do this. And if I only ever have 5 employees, I'm satisfied. You have those employers that are loving it. And then you have people who are creating things that are going to change the world. And they start with 5 employees and then they have 2,000. You have, it's all of the above, but a lot of people who want to create something and improve something. I guess that's why you would want to own a business and have control, or maybe it's just because you wanted to be able to choose to work as many 16-hour days as you possibly could within a year. As a business owner, like yes. Nobody's telling you, you just get to choose it. And you can work as many as you want.
You know, it's funny, just as like, as someone who has started something to another someone who has started something. Mm-hmm. I prefer that. Like, I'll take the 16 hours any day, as long as it's on my terms and I don't miss out on time with my kids. Right. Like, I'll take it. It's fine. It's the quiet stuff that gets to me. Like when like you're hustling and you're doing everything you can and like, you know, people aren't responding. You're like, well, is it the 4th of July or like, you know, is it slow?
July. It's July.
And then, you know, the next day, like 50 things come flying at you and you got the 16-hour day again and you can't handle all of it. But
you're like, what were they complaining about? I was so stressed and I should have been more present with my kids.
Yes, 100%.
But a lot of the baby boomers, the older generation, they have sold their businesses and they've sold them to national organizations. They've sold them to local people. We've had a real turnover of companies, and it's interesting to see. It's exciting to see. For example, WebMD bought HealthWise, which that's not going to mean anything to anybody, but it put 200 people out of work essentially here. They were like, oh, okay, we don't need this office anymore, or these individuals, and they kind of laid everybody off. And so that was disruptive. But they'll all go out and start a coffee shop or an insurance agency, or, you know, who knows, a point solution for self-funding. Who knows what they'll create or where they'll go. But then you have also really young people coming up with really great ideas and building that. I had one small startup that created this wonderful idea that recently sold, and millennials. And I'm super excited for them, but they really put in the work and created something cool.
What was it?
It was called Simply Eloped. It's still around, but it was bought by the Knot.
Cool.
Yeah. And I was like, that's so rad. That is so cool. But they would plan elopements for people. So you could go on their website and they're like, yeah, we want to elope to this area. And they would have a photographer and flowers and help with accommodations and make sure you had all the correct licensing. It was all packaged together. And then you just go. You wouldn't even have to worry about planning anything.
That's genius.
It was a great idea.
I love that.
You know, it's like a lot of that. Really cool ideas come, and then or created and then become like Love Every started here. Like all kinds of fun things. So I guess I waxed poetic about how to start a business in Boise. It's anybody's welcome to do that.
That's awesome. And how long have you had your own business?
There was a brief stint that I was part of a regional agency up until 2012, January of 2012. And then I collaborated with Lori Chandro from 2012. And but I've had ownership the whole time, owned my business, had influence over things. And then it wasn't until this year that I decided to rebrand myself as Keenly.
And what are you doing with Keenly? Like what is it? What's the big idea? What are you passionate about? What do you wake up in the morning saying like, hey, here's the thing that I'm creating?
This has been a lot of fun to have this, to bring this into fruition. So Keenly is, an independent business. My focus is to obviously bring change to employers and access to employees, like affordability, clarity, and the view of transparency, using that information, the data from their group to tailor solutions that actually meet the health outcomes of their employees. Because there's a whole other side to this, Sasha. It's like our whole medical system has been built on fixing one aspect of the body. So a symptom, like when you have a sick plant in your garden, you don't say, okay, this leaf is brown. I'm going to fix this leaf and make this leaf be green. And we actually take the plant and we, Google it, or we take it to the nursery and say, okay, how do I fix the whole plant? And so we haven't been fixing the whole person. I think my picture is beyond just, not sure how to package that as a product, but beyond just like, okay, we're going to do a health plan. Not only are we going to create accessibility and affordability that means something to employees, because if you have a $8,000 out of pocket, you can't afford to be treated by a doctor at all. Most people will look at their, like, okay, can I walk this off? Or maybe I've had this thing like growing that, feel like this thing right here in my neck doesn't feel right, but Google says it's okay. So I'm going to just keep moving on until it's, the train's left the station and, we're at the point of no return. But, it's just, that's super meaningful. But then what is it that we're putting in our bodies? How are we treating our bodies? What is that? I mean, I would love to get to the point where it's like, okay, not only are we having really great solutions for you, should you need to go to the doctor, but what are we looking at as far as your health? And that's like that's the coup de grace. Like, we've got this in and people are actually making better choices and they're putting better things in their bodies, or we're creating access for that too. So I don't know if that's probably not possible. That's a pipe dream.
I think it's all possible. And it's all connected. The what are we putting in our bodies is hard because it's not a part of our medical system today, outside of if you have a really great primary care physician, they'll talk to you about that stuff.
Right.
No one's taken you to, my wife and I were actually just talking about this. We're like, okay, we've got 3 little kids. We buy a bunch of stuff at Trader Joe's because it tastes good and it looks cute and there's stuff that people like, but like half the stuff is processed junk. It's just packaged really well. I saw this funny tweet a little bit ago that's like, whomever was the genius that took like TV dinners from the 50s and turned them into like these cute little ethnic like Trader Joe's things. And like, it's great, but I don't know if we're putting a bunch of junk in like our bodies and more importantly, our kids' bodies. And so like, I don't know, do we spend more money on organics? Do we go to different grocery stores? Do we mix it up? I don't know what the right answer is, but it's certainly like, that's not a part of our medical system today. And
no, our food system is part and parcel into everything that's going on in our medical system. If you feed your body a bunch of high, processed foods, it depletes your microbiome in your stomach, which is the foundation of your overall health. It's just like, okay, you got to like, well, it's like a chicken or an egg thing. Like, what do we fix first? And it's really, it's very conflictive. But I think what brought a lot of this to the forefront for me was this increase in Ozempic and Mounjaro and their weight loss components and people wanting to take these medications. Yeah, I get it. I totally get it. Because, in our culture, and not just here in the United States, but also all around the world, we have taken the conflict is for anything out of our lives, right? We can have the food directly ordered to our door. We don't have to walk. We can get an Uber. We don't have to do much. And I'm not saying, and this is not my intention to say like, oh, people who want this want an easy button, because I don't believe that is the case. I think that there's lots of aspects to taking these medications, but prescribing a medication like that to somebody and not saying, okay, let me give you some tools. How can we help you be successful with this for long term? Because if you're going to eat one meal a day, let's make sure that the meal is the highest quality meal you can get. Or, all right, if you're going to lose body mass, did you know you lose all your body mass, not just fat, you lose your muscle? And if you were to gain it back, you're not going to gain back your muscle, you'll just gain back fat. So let's get you doing some strength training. Let's figure out a way that we can incorporate that into your life, because you're going to start feeling a lot better because you don't have the weight. And let's use that time to, really like accelerate your health.
One of the things that we've gotten really excited about in the stuff that we're building at Milu is, if you look at our healthcare system, there's really cool, innovative stuff happening in pockets. One of the ones that I was pretty surprised by is all the Medicare Advantage stuff. And there's big downsides to it too. But in these new models where there's value-based care and accountable care organizations, somebody is saying, listen, I'm going to be responsible for patient Jane Smith's whole everything. And financially, I'm responsible, whether that's the provider or the payer or, Oak Street Health or whoever it is. And so I've got the incentive to like go and do everything I possibly can to keep them healthy, because that's going to cost less money. And so like I heard that Oak Street Health for seniors does 4 appointments a year. Now, part of that could be to, find more diagnoses, because then they or the payer get paid more. And it's a whole nother problem and issue. It's not for me to solve. But, that's a 65, 70, 75-year-old person who gets 4 primary care visits a year. Like, that's really cool. For employers, that doesn't exist. And we haven't built that, but I do think there are ways to use data to find the gaps that today don't happen. When like, if you go to the cardiologist, they're going to help you with your heart stuff. But if you miss the appointment this year, nobody's calling you. Like, it's not happening. You just missed it. But that data is there, and you can go and start finding that stuff. So, I think
that to help people. I think there's a lot of just reservation because this is going to be expensive, or it's hard to do, or it's a lot of waiting, or I feel dismissed when I go into providers. And that's why I love direct primary care so much. It's like, okay, let's use direct primary care. And I love Nice Healthcare specifically for this, because their care management model is fantastic, bar none. Probably one of the best managed programs I've ever worked with direct primary care. But, like giving that whole meaning, like, all right, we want to help you in this way, but if you don't go to this appointment, we can't. And, let me help you. Schedule that time. And they will actually schedule those appointments for people and then follow up on them with.
That's huge.
Like, oh, yeah. Like, did you go? How was it? And then they do the care management. They'll coordinate care with that specialist, ongoing care. So they do manage that patient's care and then sends all of their data. Like, these are all of the things we did with the patient, and gets that reciprocity so that they can continue to treat that patient, but they have an ongoing relationship that's accessible.
That's huge. Are they Boise based? Are they virtual?
They are based out of Minneapolis, Minnesota. They are virtual and in person. So unfortunately, not nationwide yet, but because they are a nurse practitioner led organization, and not every state will allow a nurse practitioner to run their own office. 70% of the primary care can be managed virtually. 30% requires an in-home visit. And so they'll meet patients in their homes or their place of work, wherever, or a friend's home, whatever's convenient for them. And which also, like, if I have to draw blood and I'm on my own couch and I'm afraid I'll pass out, at least I passed out on my own couch.
That's cool. I haven't heard about that model of find amazing NPs and have them go to people's homes or wherever for the 30% that's needed. Like that's amazing.
Yeah, and they bundle in all the lab work, so employees don't pay for labs. They don't pay for X-rays or EKGs, for example. They don't pay for. They have some of the prescription drugs, 550 of the most common generic drugs. You get those for free. They also have physical therapy as a component, and mental health, more like coaching, not long-term mental health, but as a service, and that's all included. So employees pay nothing, and neither do their family members. So
that's amazing.
It's awesome. And then you can see everything on your app. You have your whole medical record. It's nice.
That's really cool. When you go to employers now and say like, hey, here's the thing that we've built, what do you hear from folks around Boise? Like how receptive are people to doing something new? How ingrained are they in the status quo?
They're pretty ingrained in the status quo, but they're pretty curious about what's available. The hesitancy is in the lack of education. So, while I have the big, giant dream of like, let's not only fix your healthcare, but let's come up with solutions that create long-term health outcomes. The other part is right now is like, okay, great. I'm going to just start educating my community on a regular basis. So I started planning self-funded 101 classes, basically just so people can learn, like, this is what stop loss is. This is what reinsurance is. This is how it works together. This is how you can build a level funded plan, and really go through those foundational basics, and even to demystifying all the acronyms like TPA, ACA, CAA, like throw those around. HSA, you can throw HSA around and people are like, I'm not sure what that is. So, so just taking out all of that, demystifying that. I think most people want to stay with what's familiar. It's uncomfortable for us to make those types of changes, and it feels risky when you hear self-funding. So I try to stay away from that and stick with language like, let's unbundle your health plan. Let's look at a different type of network. Let's buy insurance differently. That way it's like people, because I think a wall goes up like, oh, we don't want to go bankrupt,
right?
With our insurance. And I don't want you to either. So like, let's,
that would not be good.
Me neither. I really don't want that call. So I'm going to do everything I can to avoid it. But a lot of employers are now saying, I keep having employees come in and tell me, why do I even have insurance? It doesn't pay for anything. And they're tired. They're like, I'm paying an enormous amount of money for a benefit that is not a benefit. And
right.
And honestly, it's like, explain yourself. Like, it's where it's like, explain this to me. Why are you selling this to us? It's not a benefit. So there's a lot of curiosity around how can I offer real benefits to my employees? And what does that mean? And I think people are getting more and more used to the idea of like, all right, we might have to build in incentives for different networks. We might have to do some things a little bit differently. But it's only going to be a fit for employers who are willing to do some of the work, communicate with their employees, you have to be able to already have a really strong relationship with your employee base. Communication is critical for the success of these programs. That's one of the ways that I assess it, but that's fine. In the self-funded 101 classes, we okay, we're going to do this time, and this is how you deploy a plan, and this is what you should expect, and things that you should have in place. And then putting together communication schedules. So, one for the client, one for them to send out to their employees on a regular basis so that they can continue to educate their staff on what benefits they have, how to use the benefits, and how to be effective. It's a challenge because St. Luke's will not bill reference-based pricing plans. So it has been a challenge. There was a moment where things were going well, and then people had there got to be some bad blood because of the they won't even bill our insurance. We have to bill it ourselves.
And how do you approach that? Is reference-based pricing a viable option for folks that need St. Luke's? Or, I've heard in other parts of the country, if there's one big health system and they just put a big red, no-fly zone on RBP plans, it's hard, and you got to look at other options.
It is. And so we do have access to direct contracts for employers with St. Luke's. So if it says St. Luke's, we have a negotiated bundled pricing with them that we can use, and then wrap everything else with RBP. Got it. We found that most of the independent providers actually prefer it because they are reimbursed quicker. Yeah. The prior authorization process isn't as intense. And they typically get paid a little bit more than some of their other reimbursement rates, even with RBP. So, it's for them, that's an easier process. Makes sense. The direct contract totally solves it. The ones I was talking about were cases where there's no direct contracts available with a massive system, and then you're okay, well, I'm stuck. But if you can have a direct contract with St. Luke's to cover key things, that's huge. Yeah, I think hospital systems need to be wary of those types of moves, because when you have, this year, there have been unions and, other municipalities across the country that have said, fine, we'll just carve you out. I've seen a few of those examples, and that's a system working. It's a system not working, but that should happen. Yeah. And it can't happen in the old model. No. And that's economics at work, right? So you're just, that's the fundamental. You can do that as an employer. You can say, okay, people respond to incentives, economics 101. We'll incentivize our employees to go here. We're going to tell them that costs are this much higher over here and outcomes are worse. They'll do the data, the research on that. They're not going to, I would never tell somebody to badmouth anybody unless there was certifiable proof. Yeah. That's but typically the lower cost providers, statistically across the nation, are some of the ones with the highest outcomes. So, having those conversations with your insured individuals and saying, okay, this is why, because you guys can't afford your insurance premiums anymore, because the employees aren't insuring the families anymore. They can't afford to do that and do everything else that they need, save enough money for their future, their retirement. Well, if they have enough money after groceries and everything else. I've seen a lot of employees who skip MRIs, skip primary care. Your annual checkup should be free. It's all screening, but then someone gets a messed up bill from a blood test that shouldn't have been billed, and they're well, I just got billed $500 for this thing that I thought should be free. That's not my health plan working. Why am I paying for this thing? And it's a battle to win the trust back. Yeah. And you have to. It is a battle to win the trust back. You brought this up. Idaho's really competing for the number one spot in skin cancer right now in the nation. I didn't know that. Oh yeah, we're trying to win there, which is not where we should be. But your dermatology visit isn't covered, right? And a lot of people think you have to go to your dermatologist for a skin cancer check. And you don't. You can do it with your primary care provider. I mean, they're going to send you to a dermatologist if you have a lot of abnormalities on your skin, or they notice that you're like, okay, you know what, you need to go see this person for these reasons. But they can do the initial one. But still, even then, to do a skin check isn't included in the wellness plans. And so people don't ask for that service because I don't know how much it's going to cost. And if they have to remove something from my skin and test it, that's going to cost. And I don't have $400.
Yeah.
So I guess I'll get the skin cancer. Just wear sunscreen.
I've got another question for you,
Okay.
and we talked about this for a second earlier. But as a business owner, what have you learned on this journey? Like, where have you messed up? And you can throw this back at me too.
I'm going to throw this back at you. Yeah.
And like, what are the learnings? I should say, where have you messed up? Like last week, or like yes, like
what are your greatest failures? Well, yeah, I mess up all the time. I think everybody does, right? We're all human, and if you say otherwise, then we're probably not friends, because that's not real. But I think a lot of times we talk about how great we are, and we forget to talk about like, hey, wow, that was, I would say, some of my biggest mistakes, like regrettable in business. I mean, there's multiple, right? Not being responsive when I first started, taking things for granted, those things. But the things that haunt me, the thing that haunts me the most and that I've learned from is there have been times that with colleagues, I burned bridges that I didn't need to burn, that I was a little ego-y and thought that I was going to be like the tough person on campus and say, all right, whatever there's multiple times, like it's regrettable, because you run into them in the business or throughout town. And I think I could have managed that better. I could have been better there. It's easy to kind of lose your mind over, getting mistreated, or somebody said something, or they didn't do what you thought that they should have done. I'll even say it with like vendors now or whatever. I'm not going to react. I'm just going to sit on this for a little bit before I make a response. And I am going to assume that they're doing the best that they can. With that mindset, I've been able to unbundle this partnership with Lori and it be elegant, and, working with, dividing everything up, working with attorneys. They're like, I can't believe you're doing this like this. I can't believe this. They're like, this never happens. People get ugly. People, fight over the small. I said, no, I don't want to just fight over stupid stuff. I told my attorney, I said, here's the deal. I love Lori. We do a lot of the same things together. I said, or not together. I mean, sometimes we've been together, but we do a lot of the same things. We see each other at events. I said, what I want to do is I need to end this in a way that I can stand in a room and she be there and we be excited to see each other and we catch up with each other. So whatever I need to do to make that happen, I'm going to do. And she felt the same way. So it's been really beautiful. But
that's awesome. It's funny when it comes down to it. I've kind of learned that like the most important thing is to make the right decision and to be fair and to do in our business to do things that are going to help employees and patients and also help employers.
Yeah.
And then beyond that, like I would be willing to sacrifice a lot of money to not have unnecessary pain. Sometimes making the right decision is painful. Great. You got to bite the bullet. But other times, like whatever, it's not worth that amount of money to wake up every night regretting that you did a thing. Like at the end of the money is not worthwhile.
It's not. And, there have been times that like when I was early in my career that I sent an email that was just kind of like, oh God, if I could if I could go back in time to this vendor, because I just used the F word and I was like, da, 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 da. I mean, this was years ago, so young. And they responded with me and they said, it's really not okay for you to talk to me like that. It was like that big failure did teach me, like, don't mistreat people.
Yeah.
Especially people you have to work with long term.
And the flip side is, like, you shouldn't hold people to lower standards. You know what I mean? Like, if someone messes up, like, they need to know that. And you got to be upfront and tell them fast. I mean, one of the things that I've learned is, like, when you know that someone's not a right fit for a job, like, it's not fair to them to, like, let that linger for a while. Like, you have to make decisions quickly, but you don't have to be an asshole. You
should be an asshole, Sasha. Like, well, you can say it nice.
Exactly.
It'd probably get a lot further in your life. And you won't be like, why did I do that? Like, oh my gosh, if only that would be advice I gave to my budding self, would be really, really careful. You're going to keep running into these people.
Yeah, we're at time. Well, Lindsay, thank you for doing this. I've loved our podcast episode, and I'd love to do it again someday in the future. But thank you for being on.
Yeah, I'd love to do it again in the future too. And yeah, it's awesome. I'm really excited. Thank you so much for taking the time, Sasha. I hope you have a great week.
Thanks, Lindsay.
Thanks for listening to Healthy Savings by Milu Health. If you would like more information about any of the topics you have heard today, we would love for you to get in contact with us. Find us on the web at miluhealth.com.